My name is Dr. Raphael Kelvin. I'm the National Clinical Lead for the MindEd programme, and I'm also a consultant and associate lecturer in child nurse and psychiatry based in Cambridgeshire. The MindEd programme is a programme aimed at developing a comprehensive portal which will address the needs of the 12 million children in our country and those who have mental health problems in particular. We're aiming at an audience of adults who work with those children, right from the universal sector, be it a youth worker or a priest or rabbi or a policeman who's not a specialist in mental health, through to people who have specialist mental health work or really rather specialists in working with children and young people's mental health. And so we're aiming to develop a portal that provides engaging, accessible information for up to 1 million adults who work with children and young people who may have mental health problems in this country. The MindEd programme, which is producing the portal, is there to meet the e-learning objectives and the needs of this 1 million adults who we're talking about, who have some relationship or working role in relation to children and young people who might have mental health problems. And there's been many calls for more information, more knowledge, more help in developing skills in relation to understanding and knowing about mental health problems for children and young people. And we feel that the MindEd portal will be able to fill some of those gaps by being accessible at all times through the internet in all kinds of devices, tablets, computers, laptops, and to some extent even on mobile phones, for people in all kinds of settings and all kinds of situations. It will increase the spread of this knowledge amongst many people who've been calling for this. It won't replace individual skilled clinical staff, but it will support staff in developing and delivering trainings to those many people, and have a range of reach into these people's experiences of looking after young people, which we've been unable to achieve so far with conventional methods, but the internet now opens up that kind of possibility, and we want to make maximum use of the new electronic media that go alongside the internet to achieve that. We believe that the benefits will be that professionals working with children will be better able to engage with children and young people, listen to them, understand them better. Something that children and young people who have serious or significant mental health problems say is often missing at some point or another in their journey through their care pathway, through their journey into difficulties, that they find that there are some adults who are terribly good at listening to them and understanding them, and others who really seem to struggle or even avoid even sitting down and listening to the problems. So we're going to be encouraging and developing the skills and the aptitudes and the knowledge in relation to how to sit down and engage with young people, how then to understand the information better that's arising, the differences between normal developmental pathways that children may be on, with little blips if you like, versus when that pathway is really going a bit awry and this is an indicator of a more serious problem. What to do when those kind of situations arise, when to wave a red flag if you think something really serious or urgent is occurring or in front of you, when to refer on, and how you might give some first aid or early help to that young person, so that we're empowering many more people to help many more young people more efficiently and effectively. We know that the rates of detection of significant mental health problems are well below what they should be. We know that many young people have their problems missed and that they end up in situations with their education or their family situations or legal and criminal justice situations which could have been averted if their problems had been rightly detected early enough or appropriately enough. So we think that early detection and appropriate intervention, so even those who are being detected aren't necessarily being directed towards the right kind of interventions, the right treatment at the right place and the right time, and we hope the MindEd programme will help that happen better. And ultimately, therefore, the increase in knowledge and understanding about all this will provide increased support and increased engagement of our nation with its children who are vulnerable and who have mental health problems, because that is in everybody's interest. We know that once mental health problems get established and entrenched, the chances of them persisting, continuing, do increase, and persistence into adult life can, for example, result in decreases in life expectancy for some serious mental health problems of 15 or 20 years. They have major impacts on the economy of this country. They're probably the first or second highest health impact on days lost at work and economic cost, not to mention the personal, social and familial costs of those problems. So getting it right as early as possible, intervening as early as possible, as effectively as possible, are crucially important. And we have plenty of evidence pointing in many of the directions that I've just spoken about.